I noticed something interesting about a week ago when a patient came into my office completely convinced that winter weather was going to give him a heart attack. He'd read something online about seasonal patterns and cardiac events, and frankly, he seemed more worried about the approaching cold front than his actual risk factors. It got me thinking about how these kinds of health stories spread through communities, especially when they touch on something as universal as weather changes. This wasn't an isolated incident either. Over the past few years, I've had numerous similar conversations, particularly as we approach the colder months. Patients come in with genuine anxiety about temperature drops, asking whether they should avoid going outside when it's below a certain threshold, or whether they need to adjust their medications seasonally. What struck me wasn't that he was concerned about his heart health. That's actually encouraging, but rather how he'd latched onto this seasonal angle while completely overlooking some pretty significant lifestyle factors we discussed in previous visits. His blood pressure readings had been creeping up for months, his stress levels were through the roof due to work demands, and he'd gained about 15 pounds since his last physical. He was working 60-hour weeks, barely exercising, living on fast food and energy drinks, and getting maybe 5 hours of sleep per night. But somehow, winter weather had become his primary cardiac concern. I see this pattern frequently. Patients will fixate on external factors like weather patterns, air quality readings, or seasonal changes, while minimizing or dismissing the daily choices that have much more substantial impacts on their cardiovascular health. It's almost as if focusing on something beyond their control provides psychological relief from addressing the things they could actually change. The weather becomes a convenient explanation for health anxiety, deflecting attention from more challenging lifestyle modifications. It's worth paying attention to how often this comes up. I've been in practice for almost 2 decades, and I can say there's definitely some observable pattern when it comes to timing of cardiac events in colder months. Emergency departments consistently report increased cardiac-related visits during winter months, and this pattern appears across different geographic regions and healthcare systems. The question isn't really whether we see more heart-related emergencies during winter, because we do, but rather what's actually driving that increase and whether it's the cold weather itself or something more complex. What makes this particularly interesting from a clinical standpoint is that the pattern seems to hold even when you account for obvious factors like holiday timing or influenza seasons. The statistical correlation appears robust, but correlation, as we know, doesn't necessarily indicate direct causation. Yet patients and even some healthcare providers often interpret these seasonal statistics as evidence that cold weather directly triggers cardiac events. From a clinical perspective, there are several mechanisms that could theoretically link cold weather to cardiovascular stress. When temperatures drop, blood vessels naturally constrict to conserve body heat. This vasoconstriction can temporarily raise blood pressure, which puts additional strain on the heart. For someone with existing coronary artery disease, this additional workload could potentially tip the balance toward an acute event. Cold air can also trigger bronchospasm in some people, making the heart work harder to maintain adequate oxygen levels. These aren't controversial observations, they're basic physiology. But the physiological response to cold exposure isn't uniform across populations. Younger, healthier individuals typically adapt to cold stress without significant cardiovascular consequences. The people who might be more vulnerable to cold-induced cardiac stress are generally those who already have compromised cardiovascular systems, the very individuals who would be at elevated risk regardless of seasonal factors. But here's where things get more complicated. The same time period when we're seeing this supposed increase in cardiac events also happens to coincide with holiday seasons, dietary changes, increased alcohol consumption, disrupted sleep patterns, family stress, and significantly reduced physical activity levels. People are indoors more, moving less, eating differently, and dealing with seasonal mood changes. They're also more likely to ignore symptoms or delay seeking medical care during busy holiday periods. The dietary shifts during winter months are particularly significant. Holiday gatherings typically involve foods higher in sodium, saturated fats, and refined sugars. People tend to drink more alcohol during social gatherings, which can affect blood pressure and heart rhythm. Physical activity patterns change substantially, with people less likely to maintain regular outdoor exercise routines. Sleep patterns become more disrupted during winter months for multiple reasons. Holiday travel, social obligations, and changes in natural light exposure all affect circadian rhythms. The psychological stress component is also considerable, with winter months bringing financial pressures, family dynamics, and for many people, seasonal affective changes. What's particularly challenging about isolating the weather factor is that all of these behavioral and environmental changes happen concurrently with temperature drops. It's nearly impossible to study the effects of cold weather in isolation from the complex web of lifestyle factors that change during the same time period. I remember reading through some of the research on this topic a few years back, and what became clear was that teasing apart the actual causative factors is incredibly challenging. Are we looking at a direct physiological response to cold temperatures? Or are we seeing the cumulative effect of multiple lifestyle and behavioral changes that happen to occur during the same season? Most likely it's elements of both, but the relative contribution of each factor remains genuinely unclear. The research literature itself presents a somewhat confusing picture. Some studies focus exclusively on temperature data and cardiac events, showing statistical correlations that suggest direct weather effects. Others emphasize the importance of lifestyle factors, social determinants, and behavioral changes. Still others try to control for multiple variables simultaneously, but these studies often reach different conclusions depending on which factors they prioritize. Geographic variations add another layer of complexity. The winter cardiac event correlation appears stronger in some regions than others, and it's not always the coldest areas that show the most pronounced effects. Urban versus rural differences also emerge in the data, suggesting that factors beyond just temperature might be influencing these seasonal trends. The methodological challenges in studying this topic are substantial. You can't randomly assign people to different seasonal exposures. You can't control for all the confounding variables that change seasonally. This means that even well-designed studies have inherent limitations in establishing clear causal relationships. The media tends to focus on the weather angle because it's straightforward and attention-grabbing. Cold weather causes heart attacks makes for a much cleaner headline than complex interaction of seasonal factors may contribute to increased cardiovascular events in winter months. But that more nuanced version is probably closer to what's actually happening. Social media amplifies this simplified messaging. During cold snaps, I regularly see posts about increased cardiac risk, often accompanied by alarming statistics and urgent warnings. These posts tend to go viral because they combine health anxiety with weather concerns, two topics that naturally capture attention. The complex reality gets lost in favor of memorable, shareable content that often lacks important context. News cycles contribute to the confusion as well. Health journalists typically have limited space or time to explain nuanced medical topics, so they gravitate toward cleaner cause and effect narratives. But this simplification can create misconceptions about the actual magnitude and nature of the risk. The way these stories spread through communities is also interesting from a behavioral perspective. Weather is something everyone experiences simultaneously, so when cardiac events occur during cold snaps, the temporal correlation becomes very salient. People remember when their neighbor had a heart attack during a particularly harsh winter, but they're less likely to connect that same event to months of poor diet, stress, or inactivity leading up to it. There are different views on this within the medical community. Some cardiologists I've spoken with place more emphasis on the direct physiological effects of cold exposure, particularly in people with existing coronary artery disease. Others focus more heavily on the behavioral and lifestyle factors that cluster during winter months. What's interesting is that both perspectives acknowledge the statistical pattern, more cardiac events in winter, but they emphasize different underlying mechanisms. In my own practice, I've found that the most productive approach is to acknowledge the seasonal patterns while helping patients understand the broader context. When someone comes in worried about winter cardiac risk, I don't dismiss their concerns outright, but I try to redirect the conversation toward the factors they can actually influence. This usually means discussing blood pressure management, stress reduction, maintaining physical activity during colder months, and being mindful of holiday-related dietary and lifestyle changes. What I try to explain to patients is that while we do observe seasonal patterns in cardiovascular events, the cold weather itself probably isn't the primary risk factor in most cases. If someone has well-controlled blood pressure, maintains regular physical activity, manages stress effectively, and doesn't have other significant risk factors, a cold snap isn't likely to trigger a cardiac event by itself. This is something many people don't really think about, but the seasonal pattern we observe might actually tell us more about human behavior during winter months than it does about the direct effects of cold weather. People tend to be less active, eat more comfort foods, drink more alcohol, get less sunlight, and experience more social isolation during winter. These are all recognized cardiovascular risk factors, and they all tend to cluster together during the same time period. I've noticed that patients often focus on the weather correlation because it feels like something concrete and identifiable, whereas addressing underlying lifestyle factors requires more sustained effort and behavioral change. It's psychologically easier to worry about something external like weather patterns than to acknowledge that diet, exercise, stress management, and sleep quality probably play much larger roles in cardiac risk. The research community continues to study these seasonal patterns, but definitive answers remain elusive. Some studies suggest that cold temperature exposure can trigger cardiac events in vulnerable individuals, while others emphasize the importance of concurrent lifestyle factors. What's clear is that the relationship between season and cardiovascular health is multifactorial and varies significantly between different populations and geographic regions. The challenge in medicine is that we often have to make recommendations and provide reassurance in areas where the scientific understanding is still evolving. The winter heart attack connection falls into that category. We have observations, we have plausible mechanisms, but we don't have definitive proof of direct causation, and we probably won't anytime soon given the complexity of the variables involved. This uncertainty isn't necessarily a problem. It's actually quite common in medicine. Many of the recommendations we make are based on the best available evidence, clinical experience, and reasonable inferences rather than absolute proof. The key is being honest about the limits of our knowledge while still providing useful guidance to patients. From my own clinical experience, the patients who tend to have cardiac events during winter months usually have multiple risk factors that have been present year-round. The seasonal timing might influence when an event occurs, but it's rarely the primary causative factor. In general medical practice, patients with known cardiovascular disease may benefit from being mindful during extreme cold weather, not because winter weather is uniquely dangerous, but because any additional physiological stress can potentially affect someone who's already at elevated risk. Where a lot of confusion usually starts is when people try to draw direct causal relationships from what are really just statistical observations. Yes, we see more cardiac events in winter. No, that doesn't necessarily mean cold weather causes heart attacks. It might contribute under certain circumstances, but correlation and causation are different things, and the research hasn't definitively sorted out which factors are most important. What's probably most helpful for people to understand is that cardiovascular health depends much more on long-term patterns than on seasonal variations. Blood pressure control, cholesterol management, regular physical activity, stress reduction, adequate sleep, and maintaining a healthy weight. These factors influence cardiac risk far more than seasonal weather patterns. Someone who manages these areas effectively year-round is generally at much lower risk during winter months than someone who neglects them regardless of the season. I tend to approach these discussions by acknowledging what we do and don't know while helping patients focus on the risk factors they can actually control. For most people, that means maintaining healthy habits year-round rather than developing seasonal anxiety about weather patterns. For those with established cardiovascular disease, it means taking sensible precautions during extreme weather while continuing to prioritize the fundamental aspects of cardiac risk management. The interesting thing about this topic is how it reveals the human tendency to look for simple explanations for complex phenomena. Weather feels like something concrete and understandable, whereas the intricate interactions between genetics, lifestyle, environment, stress, and social factors that actually drive most cardiac events are much harder to grasp and address. But focusing on weather as a primary concern might actually distract from the more important work of maintaining cardiovascular health through evidence-based lifestyle practices. These are questions that come up a lot in real life, and I think the most honest answer is that seasonal patterns in cardiovascular events are real, but they're probably less about weather per se and more about the complex interaction of multiple factors that happen to coincide with colder months. Understanding that distinction can help people focus their health efforts where they're most likely to make a meaningful difference. Perhaps the most important takeaway isn't whether winter weather affects cardiac risk, but rather how the awareness of seasonal health patterns might inform approaches to cardiovascular wellness. There are different views on whether seasonal strategies differ significantly from year-round health practices, considering how holiday traditions and seasonal changes affect overall health behaviors.